Good evening, I'm Adrian Arsenault. Andrew is off this week. Tonight, breaking the distancing rules. Crowded bars, packed streets outside. Now, after a cluster of cases in Montreal, a crackdown.
We'll close your venue.
New evidence, COVID could hang in the air for hours. And scientists are warning the WHO is ignoring the risk.
Wait.
The debate over racial profiling in the UK after a champion sprinter is handcuffed by police.
It was just awful.
Surviving a mudslide.
Like a freight train going through your middle of your house.
We just trudged our way out. I don't know how we did it.
How a BC couple escaped when they were suddenly swallowed by a wall of dirt and stone. This is The National. As Canada reopens step by step, there is always that looming threat that one careless move, one slip, could send case numbers spiking. And right now, scenes like these are stoking those fears. Bars in this country crowded with people, not always social distancing, even in the middle of this pandemic. And the big worry about that is coming true near Montreal, an outbreak of COVID-19 linked to a group of young people who went out partying. As Alison Northcott shows us, that has the province threatening a crackdown.
This video posted on social media this weekend shows a packed bar just outside of Montreal. It's become a focal point for the region's public health authorities after a group of about 60 young people attended 2 house parties last Tuesday. Some then went to the bar.
We already have more than 20 people that have had a positive diagnosis.
Public health is asking anyone else at the bar that night to also get tested for COVID-19. Quebec bars just got the green light to reopen a week and a half ago. At this pub in Montreal, there's hand sanitizers, bartenders are in masks.
As you can see, lots and lots of tables have been removed.
And tables are 2 meters apart. Customers have to stay seated, but the owner worries not everyone is enforcing those rules.
We're all trying to get back on our feet. We don't want 1 or 2 sort of rotten apples kind of scenario to spoil the whole bunch.
Quebec's public health director says the current outbreak is a reminder the virus is still a risk.
I can certainly stop certain sectors if people don't oblige it. And I could say even to Quebecers, go back home if needed, because this is something of life or death.
And it's not just in Quebec. On St. John's George Street this weekend, a similar scene prompting concern and frustration.
To see that happen on the weekend is very disappointing. People need to take more responsibility.
This expert worries outbreaks among younger, healthy people could spread the virus to those who are older and more vulnerable.
I think we need to be ready to be more severe and have more stringent measures, monitoring and enforcement, than just letting people be.
The message to bar owners is very clear. If they're not following the rules, we'll have appropriate measures.
Quebec's health minister says those measures could include fines and increased police presence and even shutting some bars down. Alison Northcott, CBC News, Montreal.
Now, Montreal is joining a growing list of cities that are making masks mandatory. The rule in the works is expected to go into effect July 27th, requiring face coverings in indoor public spaces. Ottawa announced a similar rule going into effect tomorrow at midnight. This follows Toronto, whose mask rule also goes into effect tomorrow. It is a policy move that faces pushback in the United States, where masks are a partisan issue, despite mounting concerns because those COVID-19 infections just continue to spiral. The pace of new cases in the U.S. remains faster than ever, with more than 40,000 positive tests a day. Thankfully, the trend so far in deaths continues to mirror the rosier picture weeks ago when the curve was more flat. As Paul Hunter shows us, that is the picture the White House is emphasizing.
It would seem a fairly easy to accomplish imperative to help slow the spread of the coronavirus in the U.S. Wear a mask. And indeed, lots of Americans are. But millions are not. And they're congregating, spreading the virus, worsening the crisis in this country daily. This past holiday weekend, merely an extreme example of what plays out here regularly. So, does catastrophe now loom?
I'd say we're pretty close. I do anticipate that after this weekend's parties, we're going to see a bump.
And consider that in those states where COVID has lately been spiking, Texas, for example, hospitals are already near capacity. And yet, in Florida, where a man dressed as the Grim Reaper marched along busy beaches, signaling people should take more care, pushback.
Take that off. If you will, take that off.
On the aversion to self-protection, many point to the example set by Donald Trump, who not only doesn't wear one, but this weekend said with increased testing lately,
we show cases, 99% of which are totally harmless.
That's close to the survival rate, but ignores the roughly 20% of cases bad enough to need hospital care, said Trump's press secretary today.
The president was noting the fact that the vast majority of Americans who contract coronavirus will come out on the other side of this.
In New York, meanwhile, where following strict guidelines turned things around, they're now well into reopening. Today, a call for Trump to emphasize COVID is a very serious problem.
If he does not acknowledge that, then he is facilitating the virus.
And goes the thinking contributing to more COVID illness and death in a country already leading the world in both. Paul Hunter, CBC News, Washington.
Scientists from around the world, including Canada, say there is enough evidence now that COVID-19 is airborne that the WHO should change its guidelines. But as Vicadopia tells us, other researchers disagree.
Thousands of droplets fly through the air with every cough, the most common way for the coronavirus to infect others. But there are also microscopic particles, smaller than droplets, that can remain airborne, floating around for several hours, released by just talking or breathing. In an open letter to the WHO, scientists warn that's why hand washing and physical distancing aren't enough to stop the outbreak.
If you do not block all the routes of transmission well, or if you do not block them efficiently, what you're going to see is that flattening the curve will be extremely slow.
Point to an outbreak in this choir in March as one example of a super spreading event where one person infected dozens of others. The WHO has downplayed the risk of airborne particles because not enough is known about how infectious they are. But experts in fluid mechanics say the WHO's understanding of the subject is decades out of date, as the emerging science doesn't even draw a distinction between droplets and airborne particles.
It is stuck in a nomenclature that is rooted in science of the 1930s, the physics of the process that have been observed, measured, modeled, and validated.
The letter calls for better ventilation, asking that the WHO urge governments to mandate upgrades before allowing reopenings, especially in schools, workplaces, and seniors' homes, where lots of people congregate, though not everyone agrees it's urgent.
You need to focus on the certainties and spend less time and energy focusing on the things that might have some impact but do not appear to be as important.
One of those certainties is the continued use of masks, as well as the need for vigilance. Vicadopia, CBC News, Toronto.
For the first time since late March, Ontario is reporting no new COVID-related deaths. But health officials are investigating another farm outbreak in the Toronto area. 30 workers have tested positive at this mushroom farm in Vaughan. Officials are now following up with the close contacts of those infected, but they say the risk to the public is low.
Today, I'm pleased to report no new additional cases.
And that's some really welcome news today in PEI. After 5 new cases were reported over the weekend, at least 4 of those are linked to a man returning from the U.S. to Nova Scotia. Officials there have now imposed stricter measures to ensure people from outside Atlantic Canada self-isolate upon entering the province.
We want to make sure that what we've seen in other jurisdictions doesn't happen here. So we're taking these extra precautions now to protect patients and our staff.
And so this Edmonton hospital has closed its doors to new admissions as officials work to contain a COVID outbreak that's claimed the lives of 2 people there and infected more than 30 others. Some departments, including the emergency room, remain open. Nick Cordero is being remembered today as a talented actor, as well as a loving husband and father. The 41-year-old Canadian-born Broadway performer suffered severe complications from COVID-19. Eli Glasner spoke with friends from his hometown of Hamilton.
Not every actor could switch from waving a Tommy gun to tap dancing. Nick Cordero was not every actor.
I was really hoping for a different outcome.
Cordero and Theo Cutalos were friends since grade 6.
He was like a gentle giant. His inner self was just as big as his body.
But Cordero did what most actors just dream of. He went from bussing tables to dancing on Broadway. So when he entered the ER in late March, word spread quickly in his Hamilton hometown.
It hit people very hard because Nick was so young and healthy.
I'm sitting outside of Cedars-Sinai Hospital right now.
Online, his wife, Amanda Klutz, shared daily updates. In the ICU, the actor battled against a series of setbacks. In April, surgeons were forced to amputate his leg due to coronavirus complications. Last week, Klutz described the toll it had all taken.
The longer you're in the ICU, the longer you're on a ventilator, your body's more susceptible to infection. And that is what we're seeing with Nick.
All the while, celebrities shared their support.
You have that eye of the tiger.
And castmates performed a song he composed. His critic followed Cordero's rise, first in Bullets Over Broadway, which earned him a Tony nomination, then the musical A Bronx Tale.
He was just a really charismatic guy. He could play these gruff gangsters, but still you really sort of felt for the character nevertheless. He was really you could tell he was a star in that show.
But on Sunday, his wife shared the news. Cordero died surrounded by his family, singing and praying. Cordero's castmate, Zach Braff, said, "I've never met a kinder human being." Back home, the news was a wake-up call.
It's really made it real.
Yeah.
You know, and it made me actually be more thoughtful and careful with wearing a mask and making sure everything's clean, and because it's scary. It's a scary time.
Another sign of the impact from a life that moved so many. Eli Glasner, CBC News, Toronto.
Among the other stories we're following tonight, the Canadian reservist accused of ramming a truck through a gate at Rideau Hall last week is now facing 22 charges, including threatening to cause death or bodily harm to the Prime Minister. Corey Hearn allegedly had 2 shotguns, a rifle, a revolver, and a prohibited high-capacity magazine. Police say his motivation is known, but they would not disclose any details. And Justin Trudeau, meanwhile, will not join his North American counterparts to mark the start of the new NAFTA agreement. The Mexican president will be at the White House on Wednesday for a bilateral meeting, but the Prime Minister's office says he will remain in Ottawa for cabinet meetings and the long-planned sitting of Parliament. And Bob Rae has been named as Canada's new ambassador to the United Nations. Rae was interim leader of the Federal Liberals and served as the Premier of Ontario in the 90s. He takes over just weeks after Canada failed to secure a temporary seat on the UN Security Council. Well, Ontario says it will no longer divide grade 9 students into 2 streams, those expected to make it to university and those who've been told they're less able. Black and low-income students are by far most likely to limit their goals because of that system. Jacqueline Hansen takes a deeper look at why.
Benjamin McDonald always knew he would go to university, but not everyone agreed.
In grade 5, my teachers told me, your kind don't go to university, you should settle for college.
An early, unofficial streaming of black students that his mom, now a school board trustee, says starts in kindergarten.
A lot of these kids, by the time they enter high school, they are so disengaged, their dreams have been squashed.
There's also an official streaming of students in high school in Ontario that disproportionately puts black students on a path towards college or trades, not university, and it starts in grade 9.
You're asking a 14-year-old child to make a decision in grade 9 where the rest of their high school career and post-secondary schools that they're going to. And I just don't think it's right.
So the government says it's ending the grade 9 divide between academic and applied streams. And it's banning suspensions for young students, which have also been shown to target black students.
The education policy and practices have systemically discriminated against black students and black communities for far too long.
This educator says the changes could help dismantle a culture of low expectations.
It definitely is going to create a level playing field for students.
Ontario tried to de-stream grade 9 in the mid-90s.
I was a classroom teacher in the 90s, and I taught de-streamed grade 9 English classes, and they were difficult.
A teachers' union says it wasn't aware of the province's plan to try again.
I have a great deal of concern about the sincerity of his pursuit of this goal.
Still, it's the type of progress Kathy McDonald has been fighting for.
It has been very frustrating and dehumanizing a lot of the times. And to finally see changes, I feel like somebody's actually listening.
She hopes it's just the start. Jacqueline Hansen, CBC News, Toronto.
Still on issues of race, a Canadian-born woman could face a year in jail for doing this.
There is an African-American man. I am in Central Park. He is recording me and threatening myself and my dog.
Today, New York State officials charged Amy Cooper with filing a false report. In May, she called 911 to say a black man was threatening her. In fact, the man, an avid bird watcher, had asked her to put her dog on a leash as is required in that section of Central Park. A top British sprinter says she and her boyfriend were racially profiled by London police on the weekend. Margaret Evans shows us the video that today forced the country's leaders to say where they stand on systemic racism.
A video already viral. The distress in Bianca Williams' voice clear.
He didn't do anything!
First, when her partner was taken out of the car and handcuffed by police. And then as she was forced out of the back and away from her 3-month-old baby. The couple deny police claims that they were driving suspiciously.
I've never been in that situation before, and to be in that front line along with my son, it was just awful.
Bianca Williams. Williams is a champion sprinter hoping to represent Britain at the Tokyo Olympics. Her partner, the Portuguese sprinter Ricardo dos Santos, says it's not the first time he's been stopped by police for no apparent reason.
I would say it's my normal, which it's horrible to say. It's normal.
Tens of thousands of Britons have taken to the streets in Black Lives Matter marches in recent weeks. Black people in the United Kingdom are nearly 10 times more likely to be stopped by police in stop and search operations than white people. Critics say it proves Britain has yet to deal with institutional racism.
You know, we have one word for a kaleidoscope of inequalities: racist. And too often people are in denial of it because it sounds so awful. And yet the facts speak very clear.
Today, the British Prime Minister Boris Johnson, who has been taken to task for using racist language in the past, was asked if Britain is a racist country.
In the last 20 years or so, we've changed, but that doesn't mean we've done enough.
The Metropolitan Police issued a statement saying after a review, they're satisfied their officers behaved appropriately. Williams and dos Santos are said to be considering legal action. Margaret Evans, CBC News, London.
New data shows the staggering impact of COVID-19 on First Nations grappling with addiction in British Columbia. Up next, the programs lost to the pandemic and what could help. Plus, making music safely. Health officials have warned against choir singing after a deadly outbreak, but some Canadian choir directors are pushing back. And a survival story you have got to hear.
Like a freight train going through your middle of your house, that would have been about the way it was.
How Gary and Mabel Moore made it out of this alive. We're back in 2. Welcome back. Today marks 7 years since the Lac-Mégantic rail disaster.
Une en hommage à la communauté marquée par la tragédie.
The Quebec community unveiled a memorial at the former site of a local pub where many people died. In 2013, a train carrying crude oil derailed and exploded, killing 47 people. And in Winnipeg, prosecutors will seek an adult sentence for the 15-year-old accused of killing Danielle Cote. The 27-year-old woman was shot while walking with her cousin on Canada Day. A 14-year-old has also been arrested and charged with murder. The teens are accused of a string of apparently random shootings, all within 24 hours. There is another health crisis unfolding in BC, and First Nations are being disproportionately affected, the opioid epidemic. And as our Briar Stewart tells us, COVID is only making it worse.
I've had family members that have passed away because they can't use with their friends.
Chris Livingstone works on Vancouver's downtown east side. On June 21st, while he was helping out at an event for National Indigenous Peoples Day, he discovered his sister Rhonda was alone and using.
I feel terrible because I was celebrating and we were doing naloxone trainings. My sister was overdosing in a hotel by herself.
COVID-19 has meant that some overdose prevention sites have been scaled back, and health officials say more people are using alone on the streets or in their rooms. The drug supply has also been disrupted. Experts say it's now more toxic.
You know, people really stood up and got behind the public health measures for COVID-19. And because that's an infectious disease, but when it comes to the ongoing opioid crisis, that has all kinds of other, stigmas associated with it.
First Nations people make up just over 3% of the province's population, but account for more than 16% of illicit drug deaths. Between January and May, 89 people identifying as First Nations died from overdoses, a 93% increase over the same period last year.
You are taking a risk, any which way you look at it.
Melissa Steinhauer is an outreach worker and struggles with addiction. She was relieved to finally have access to prescription drugs through a new provincial program, but it was short-lived. She was cut off after she missed 2 days of daily pickups.
And I was given something and now just easily taken away. So it's a lot to take in and a lot to deal with.
She wishes it was easier to get access to a safe supply because now, like so many others, she's back to getting her drugs off the street. Briar Stewart, CBC News, Vancouver.
Still ahead on the national, business is booming at hardware stores as the backyard becomes 2020's hot summer destination.
I'm really enjoying it. I'm used to really rushing from place to place, and the fact that I'm forced to just sit down, talk to a good friend,
reaping the benefits of the stay-at-home summer. Plus, when we come back, Dr. Isaac Bogosh is here to answer your questions, including this one. My manicurist thinks the UV light used for shellac manicures will kill COVID-19. Is she right? The answer to that question and more right after this. All right, welcome back. And time now for your COVID-19 questions. With me tonight to help guide us through them, of course, infectious disease specialist Dr. Isaac Bogosh. Thank you for joining us. Let's get right to it. We are a couple in our 80s with health issues. We're apprehensive about our dentist appointments. When's it safe for us to go?
Yeah, it's a challenging question. And certainly in Canada, across the country, this infection is under excellent control. We're only seeing about 300 to 400 new cases per day in a country of 38 million people. So it's relatively low risk. I think that people should certainly adhere to the guidelines in the local community. And if dentists are open and safe to go to in your local community, by all means, you should go. But of course, everyone's going to take their own individual assessment of the situation, and people have their own risk perceptions and risk thresholds and risk tolerances. And if it's okay for yourself, if you feel okay to go and it's okay in your community to go, then go.
Yeah, still so much stress about the basic stuff. Here's another one. My manicurist thinks the UV light used for shellac manicures will kill COVID-19. I don't feel she's right. I don't want to share nail polish with other patrons. What's your opinion?
Yeah, I wouldn't be so concerned with the nail polish. I'd be more concerned with close proximity to other people in an indoor setting for a prolonged period of time. And certainly we see now there's an outbreak in Kingston, Ontario, related to a situation just like that. Certainly if the area is cleaned down, if people are wearing masks inside, that will reduce the risk of transmission. And interestingly, related to the ultraviolet rays, there are some commercially available products now that use a certain type of ultraviolet ray, it's UVC rays, help sterilize equipment or surroundings. It's not really safe to be in the room when they're turned on, but there is some evidence for ultraviolet light to be used to clean off surfaces.
Okay. Do you think it's safe that Blue Jays players and their staff have arrived in Toronto from a COVID hotspot that's Florida?
Oh, that's an interesting question. I think it's really important that we distinguish between player safety and public safety. And when we're talking about these players coming in, let's focus on public safety for a minute. Of course, we know that there are cases of COVID-19 in Florida, and sadly, that state has a significant number of cases. But when people come into Canada, they have to quarantine. And we've heard that these players are going to be quarantining in a hotel that's attached to the baseball field. So as long as they adhere to the quarantine and stay within that facility and they're not mingling outside of that area, there should be little to no risk to public safety. Now, of course, people in Florida and players who are coming in certainly might be at risk of having the infection. But as long as they stay and adhere to the quarantine, there really shouldn't be an issue with public safety. I should also remind people that day after day, there are thousands and thousands and thousands of people that come into Canada. Either they fly in or they come in across the border. So obviously this is an area that is under a spotlight because it's professional athletes. But when we look at the number of people coming in for this professional sport versus the number of people that are coming in on a day-to-day basis, it's really a drop in the bucket. So as long as they're adhering to the quarantine, there should be no issues with public safety.
Okay, briefly, you have time for just one more. I have a healthy newborn baby. Should I be completely restricting visitors due to the COVID risks?
Well, it's important that people adhere to the guidelines in their region. So, for example, in Ontario, you're allowed a bubble of 10. And if your baby, which would be included in that bubble, is part of that bubble and everyone else is adhering to the same care to make sure that they don't get infected, there shouldn't be an issue. If you're worried about people in your bubble that might be getting the infection, then you've got to really rethink who's in your bubble and allowing them access to your baby.
All right, as always, Dr. Bogosh, thanks very much.
Anytime.
We're asking your questions about COVID-19 as often as possible. So send us the questions you have. Message us directly on Instagram at CBC The National or send us an email at covid@cbc.ca. Now, there's no question the pandemic has made summer plans uncertain. But as Ioana Remiliotis tells us, with many camps canceled and most travel discouraged, for a lot of families, keeping cool means home and slowing down.
The joy of a classic summer. So magical, so simple, until you hear Natasa Zervopoulos' secret behind it.
It's not just go outside and play. We do a lot of stations. Oh, Peter.
Keeping the peace may involve freezies. Then there's all this.
The wagon is new, the bicycles are all new, the helmets are all new. And we just purchased a small 6-foot pool for the backyard. So a lot. Yeah, a lot.
For working parents, taking turns working from the garage, it's all about surviving.
Peter would have been in daycare the entire summer, and Sophia would have been in camps back to back, which is what we did last year. This year we were planning to take 3 to 4 weeks and do Greece and Cyprus. That obviously is not going to happen.
Travel plans on pause. Life in general has slowed down too. From urban escapes to backyard movie nights, staycations are now the rule. And many are finding being still feels different when you're taking your time getting there.
I'm really enjoying it. I'm used to really rushing from place to place, and the fact that I'm forced to just sit down, talk to a good friend.
I enjoy being in my neighborhood. I enjoy very simple things. I don't need to fly on a plane or whatever, so.
And with fewer places to go, it's also about making home feel like a vacation too. Pool sales are skyrocketing.
A lot of people aren't able to go to cottages or camps, so we're seeing people just really invest in their backyards.
For those on a tighter budget, anything related to backyards is going fast or already gone. From barbecues and the coal to fuel them to kiddie pools.
I get phone calls every day, or both a blow up or a plastic pool. I say, well, I don't have a pool, but I do have sprinklers, and they're disappearing.
Back on the block, sprinklers are off. The nightly social bubble is on. Their world may be smaller, but it's bigger too.
Being able to teach my son how to ride his bike, being there for those milestone moments that
you know, we may not have been there for had we been working all the time, for sure.
Yeah. And there's beauty in not having to be anywhere else. Joanna Vermeliotis, CBC News, Pickering, Ontario.
Still ahead on the National, finding a safe way to do this. Socially distanced, even masked singing. Is it enough to keep choir safe? But first.
She was very young, a loving, kind, caring person.
1 in 3 Black Americans know someone who has died of COVID-19. Susan Ormiston with the story of a pandemic exacerbated by prejudice, privilege, and politics. Right after this. With COVID-19, the U.S. already seemed to be through the worst months ago, with scenes of doctors helpless.
Just never forget their faces and the way they looked at me before dying.
Of makeshift morgues, of mass burials. As the first peak passed by mid-May, at least 100,000 people were dead. And yet now, cases skyrocket again.
The number of people who are getting sick and going to the hospitals has exponentially increased.
Officials are shouting warnings again.
We're in the fight of our lives.
We're also going to see the number of deaths start to rise again.
Put the damn mask on.
Warnings unheard or unheeded. The virus's death toll in the United States is already equal to the terrorist attacks of 9/11 40 times over. And if some seem unable to reckon with that loss or the threat of more, Susan Ormiston shows us this virus has been masked by inequality and fueled by division.
Behind the statistics are families, some Americans bearing more of a burden than others. As President Trump tries to diminish the toll still rising, loved ones are being mourned, stolen too soon. Cynthia Watson was 64. She worked at the Pentagon once before a stroke put her in a nursing home. In just 2 weeks, she went from the home to a DC hospital and died there. We met her daughter Lakeisha at the funeral home.
She was very young, a loving, kind, caring person. Due to COVID, COVID had to take her away from us, and, we just heartbroken. And just praying for the rest of the people out in the community that we don't lose any more life, because I don't want nobody to ever have to experience what I went through. It's so heartbroken.
We're all in this together, so the saying goes, but the toll in the U.S. is not equally shared. 1 in 3 Black Americans know someone who's died of COVID-19, compared to 1 in 10 white Americans. Pandemic deaths dog Trump's leadership. His playing down the persistence of the virus in favor of opening up the economy has cost him. His predictions were skewed from the start. February 26th.
When you have 15 people, and the 15 within a couple of days is going to be down to close to zero, that's a pretty good job we've done.
February 28th.
35,000 people on average die each year from the flu. Did anyone know that? 35,000. That's a lot of people.
The coronavirus has killed close to 4 times as many.
And you wonder, the press is in hysteria mode. CNN, fake news, and their camera just went off.
But by end of March, no more smiles.
What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. Go ahead.
I
think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people.
Unfortunately, we have a president in this country who governs by polarization, by confrontation, by accusation of conspiracies and of enemies, and he decided to go with the polarizing narrative about this pandemic.
Trump has made not wearing a mask a sign of independence, even blind loyalty at a densely packed rally.
I don't think we're going to be able to escape this polarized framework in which wearing a mask has become a political statement as to which side you're on.
Long before Donald Trump got to the White House, Theodore Gaffney was there as a press photographer.
He was on the first Black American to go on the White House to take pictures.
Maria Santos Gaffney is his wife.
And then he got involved with the Freedom Riders as a publication journalist.
The Freedom Riders rode buses into the segregated South in 1961, and Gaffney took pictures. He became a civil rights activist, but didn't live long enough to see this spring's revolution for justice. In early April, he got sick. He wouldn't eat or drink.
That's when he took to George Washington Hospital. And a couple hours later, they told him he had COVID-19, and he never came out.
He and Maria had met in her home, Brazil, a May-December romance. They married for 31 years, living in Washington, until COVID took him.
And tell people at the time, this virus is killing fast, especially the elderly folks. He was 92 years old. He didn't have a chance with the virus.
And Maria, he was 92, but you say he was very active.
Very active. Mm-hmm. He would drive every time I need to go somewhere. Because he's 92, doesn't mean he's deserving life like everybody else. I went to the hospital. I looked at him through the window in his room. I watched him in pain. That was not a pretty sight to see somebody you love in pain. And I be able to breathe on his own, to be able to talk, nothing like that. It was not fun to watch somebody die, especially because of COVID-19. Do not tell me because he's 92, I should accept that he died of COVID-19. I was expecting him to live a lot longer, to stay with me, because we've been together for so long. He lost his life, and I'm the biggest loser because I don't have him anymore.
In the end, the coronavirus is not buried. Pandemic politics, which propelled states to reopen, now present new deaths and leave behind newly bereaved.
What do you want to tell people, Keisha?
Stay social distance, wear your mask, don't have a large gathering, and take this serious because it don't become serious to some when they hit their family, and we don't want to ever have to bury another family member or another person in the world because we care about the people that's dying. I watch the numbers and I care about those as well. I just hope that and pray that they can find a vaccination for it so that everybody can stop dying.
Sadly, in 2020, saying goodbye is all too frequent. Susan Ormiston, CBC News, Washington.
The Canadian toll from COVID-19 is, of course, also much more than a statistic. This is real people ripped from their lives and from their loved ones, leaving memories behind. Well, tonight, we remember Jean-Pierre Légaré.
Je m'appelle Caroline Légaré. Mon père, Jean-Pierre Légaré, est décédé de la COVID le 31 mars 2020. Il avait 89 ans. C'était un homme qui avait à cœur notre bonheur, toute la famille, et il avait un plaisir de passer du temps avec les enfants, même s'ils étaient très jeunes. Il faisait preuve d'une grande patience. Il était médecin, un médecin très engagé. Il a pratiqué près de 2000 accouchements, qui l'amenait souvent à faire des visites à domicile pour soigner ses patients. Lorsqu'il faisait ses gardes à l'hôpital la fin de semaine, à l'occasion, il m'amenait avec lui. Il amenait aussi mon frère à l'occasion. C'est peut-être ce qui a donné le goût à mon frère de devenir lui-même médecin. C'était aussi un amateur de sport. Dans les années 70, il a été fondateur avec d'autres associés du club de hockey Les Remparts de Québec. Ils ont été champions juniors canadiens. Il y avait à ce moment-là plusieurs joueurs qui ont connu une très belle carrière, dont Guy Lafleur. Il m'a inspiré au niveau de son ardeur au travail, son souci de prendre bien soin des membres de sa famille. J'ai quand même pu me rendre près de lui. Je devais garder une certaine distance. Je ne pouvais pas lui toucher ou lui tenir la main. Et ce que j'aimerais qu'il sache, c'est surtout qu'on ne l'a pas laissé seul et que j'ai été avec lui et que je l'ai accompagné jusqu'à la fin.
More than 8,700 Canadians have died after contracting COVID-19. We've gathered many of their stories online. You can find them at cbc.ca/remembered. Next on The National, staying safe while coming together. Despite warnings, choir directors say there is a safe way to sing. Next.
I'm Josh Block. Tomorrow on CBC's daily news podcast, Front Burner, how the Prime Minister's relationship with the popular We charity led to his third ethics investigation. Subscribe wherever you get your podcasts.
In the age of physical distancing, this is a new normal for Canadian choirs. Belting out a tune or two virtually. It sounds good, but singing together apart isn't hitting the right note for everyone. Besides music, choirs are all about connection, something missing for a lot of people right now. And so, as Deanna Sumanak-Johnson explains, even as some health officials caution against it, Canadian choirs are pushing to resume in-person practices safely.
Their voices usually attracted crowds, but this summer, this is the only way the Elora singers and many other choirs in Canada are getting together.
Right now, it's a caution to people that this is not the time to be having your choir practice.
And that struck the wrong chord. A group of choir directors wrote an open letter criticizing what they called out-of-date, insufficiently researched, anecdotal, and sensationalist information.
Singling out choir singing as this very dangerous activity, we just want to be sure that it's not that narrative that is beginning to shape and form the policy that governments follow.
An early high-profile case where more than 50 singers in a Washington state choir contracted COVID, with 2 members dying, caught the attention of lawmakers. But how choirs typically rehearse likely played a role in public health recommendations, says Dr. Isaac Bogosh.
When we think about risk factors for COVID-19 infection, it's getting people in close proximity in an indoor environment, where you can't practice physical distancing and where you're not wearing masks.
In Europe, some choir practices have resumed, with singers standing at a distance from each other. Masks and outdoor rehearsals can also reduce risks, according to a new German study.
With surgical masks, you can sing and you can talk, you can breathe, but they prevent or they retain the droplets and some of the aerosol.
Mark Vornen says Canada's choirs would be happy to follow suit.
We just want to have a seat at that table to be able to discuss how can we modify the kinds of activities that we do to do them safely.
Until they can sing, he will continue using his voice to make sure Canada's choirs aren't silent for much longer. Deanna Sumanak-Johnson, CBC News, Toronto.
When we come back, imagine lying in your bed when a middle-of-the-night mudslide comes crashing through your bedroom wall.
It took literally 35 seconds to get our house full of mud and dirt.
How it all went down and how Gary and Mabel Moore got out in our moment. Gary and Mabel Moore of McBride, BC were in bed when, without warning, a wall of water, mud, and rocks plowed into them. They were in the middle of a mudslide and their house was quickly going under. Their incredible story of survival, well, that's our moment tonight.
We were in bed and it hit our back wall in our bedroom there and literally knocked us literally onto our feet. And we were in 2 feet of water.
Like a freight train going through your middle of your house, that would have been about the way it was. It took 35 seconds to get our house full of mud and dirt.
We had our granddaughter's little dog, and I grabbed her, and we hung on to her for the whole duration.
By the time I broke a window out, it was up to our knees.
We ran over to our neighbors, and I ran upstairs at her place. She's like 81 years old. Hollered and yelled at her and got her out of bed and grabbed her car keys and her car. And we went up the road about 1 kilometer or so and went to our friends. All I could think about was, what if another one comes down right away? Like, it would have wiped us That would have been it, because we wouldn't have stood a chance out in the middle of the lawn or like down on the road or whatever. I'm just thankful that I have Gary and he has me, and we have our family and all our friends to help us through this, and we'll get through it somehow.
Wow, Gary and Mabel, we're very thankful you're okay. Married 49 years in that house for 37. You're made of very tough stuff. Mabel said that she has bruises all over her body in places she didn't know she had skin. And Gary was in surgery for an hour and a half. We are really glad you're okay. That is the National for July the 6th.